I'm going to call the meeting to order. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item that on the agenda today, the comment will be heard earlier in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes today. Vendors, suppliers, and other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by terms of invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments or discuss negotiate claims at this meeting. With that said, just as we get started, many of you probably know, but Dr. Duncan Finley passed away this last Friday, and he has served as our CEO from 2000 to 2005 and will be deeply missed. He was an outstanding physician for over 3 decades, not 3 years. As we celebrate Sarasota Memorial's 100th year anniversary, I think it's important to remember his outstanding service, his visions, and his dedication to this institution. We owe him an enormous debt of gratitude for the major role he played, ensuring our community receives the highest level of care, and we extend our deepest condolences to his family. David, do you have anything you want to add to that? No? Okay. You can.
Can we have a moment of silence for him?
We can.
Thank you. I would just add just one thing that I thought I got to know Dr. Finley pretty well. I've been here for 20 years now, and he was I came here the year after he retired, and so I'd never worked directly with him, except he never quit working. He worked here, constantly. Started scholarship programs, worked with kids, worked with physicians, and the one story that kept telling me that I kept hearing about him from others was that he came here at a time where there was a lot of turmoil in the healthcare system, and the board asked him to be CEO. He did not necessarily seek it out nor want to be CEO, and even when he finally reluctantly agreed, he said, "All right, but I'm going to have a time limit on this," and he only did it because it was what he thought was best for the community, and he thought that he could add to it, and he was what we used to call a true servant leader, and I think it would make him good to be remembered like that. So that's my one thought.
Thank you for sharing. I appreciate it. Okay, can I get a motion for the approvals of the orders of the day?
So moved.
Great. All in favor, say aye.
Aye.
Any opposed? Chair votes yes, motion's carried. Can I get an approval for the minutes of the meeting of May 20th, 2025?
Second. So moved.
Okay, all in favor, say aye. Any opposed?
Aye.
Okay, motion passes. Thank you. There are no board reports, so we'll move on to the Excel winner, David Verinder.
Thank you, Madam Chair. Happy to get to talk about two of our Excel winners today. And the first, I'm going to ask Stephen Larstana. Hope I got that right, Stephen. Okay, to come up here and join me. Come up here and sit with. Thank you. Congratulations. First off, I'm going to say some nice things about you. Okay, but these are from your colleagues. These are what they had to say. All right, come stand closer to me. All right. Act like we know each other good. Exactly. There you go. Thank you, brother. So our first winner is the Excel recipient for May, Stephen Larstana, Operations Coordinator and Facilities Management. Steve joined Team SMH in 2022, and colleagues say he has proven to be an invaluable member of the HVAC team. He is the first to volunteer to come in early, stay late, or work holidays. He He consistently goes the extra mile to ensure air conditioning systems operate efficiency. God bless you. All right. After completing a repair, he always follows up to confirm the systems remain in working order. He makes sure everyone, including the patient, is comfortable and satisfied. And he doesn't just address the immediate issue, he evaluates the entire system to prevent future problems. Staff also say that Steve is a pleasure to work with. He always has a smile and displays kindness, professionalism, and a can-do attitude. He manages difficult situations with grace and never shies away from a challenge. Steve, thank you for everything you do on behalf of this healthcare system, our community, our patients, our doctors, everyone who's hot. Okay? We very much appreciate it.
Just real quick, I want to thank my team in facilities management and my family. Without them, I probably wouldn't be here and I wouldn't be able to do this for you guys. So thank you very much.
Thank you.
So next up, I get to invite Maggie Cabot to come up here. Maggie, come on, stand with me too. All right? Stand up here. There. Is that better? All right. So Maggie is our Excel recipient for June, and she is our gift shop coordinator. Maggie has been part of the team, SMH team, since 2013, and colleagues describe her as a wonderful leader and communicator who's a role model for excellent service. She brings her A game to work each and every day and is always professional, engaging, and positive with coworkers and gift shop customers. In fact, Maggie treats every customer as if they are the only person in the shop. Maggie also is very business-oriented and has earned the respect of the shop's vendors and partners. She goes out of her way, even on a day off, to help out when she's needed. Maggie, you don't know how much special that is. I mean, people come in here, they get a little scared. They don't like hospitals in general, right? And yet your department makes them feel good,
Exactly.
feel at peace, and feel part of a good place to be. So we thank you on behalf of everyone
you.
in our community, our hospital, our
you.
patients,
Thank
and our
you.
visitors.
Thank you.
Congratulations.
Follow up on what you said, David. I get the opportunity every day to try to put a smile on their faces as our guest. So thank you very much. I am thrilled to be honored by the board, by the hospital, and I love working in the gift shop. And I just want to acknowledge our fabulous leader, Chiro Halfieri, for leading our gift shop to the wonderful success it is today. So thank you again. It is, absolutely. We have a wonderful team. And not only our team, but our volunteers as well, who are part of our team. So thank you. Again, I'm very honored to receive this award.
Just another thank you to you both. We appreciate you putting smiles on all of our faces. Okay, next up is our medical staff report. Dr. Hurwitz, would you mind going first?
Thank you, Madam Chair, members of the board. Today, I'm asking for a motion to approve the Sarasota Memorial Hospital Sarasota campus policies, guidelines, procedures, and forms, including the SMH Sarasota Urology Surgery Privilege Form, which has been updated, and the SMH Sarasota Advanced Practice Provider CRNA, that's the nurse anesthetist's privileges form in the operating room with an anesthesiologist, which has been updated. All of these have been recommended by the SMH Sarasota Campus Medical Executive Committee.
Great, can I get a second? All in favor, say aye.
Aye.
Any opposed? Okay, motion passes. Dr. Perrin, he is online. Okay, Dr. Perrin.
Good to be with you again. Today, I'm asking for a motion to approve the SMH Venice policies, guidelines, and procedure forms for SMH Venice APP CRNA privilege form in the operating room with the anesthesiologist, as recommended by the SMH Venice Medical Executive Committee.
So moved.
Can I get a second? All in favor, say aye. Any opposed?
Aye.
Thank you, Brad. Motion passes. Thank you, Dr. Perrin.
Thank you.
Next, our Board Assistant Secretary, Vic Rohi, will read the Secretary's report for us.
Thank you, Madam Chair. The Secretary's report consists of the board schedule for the next 2 months. Our next meeting will be Tuesday, August 26th. At 9 to 9:30, it will be a closed session at the hospital board. 9:30 to 11, the Quality Committee. 11 to 12 will be the Board Education Workshop, SMH Corporate Compliance Program. On Tuesday, September the 9th, at 5:01 PM, we'll have a preliminary budget and millage hearing, and it's due to statutory concerns. And on Thursday, September 25th, due to due to a holiday, 11 to noon will be the Mission and Planning Committee. Noon to 1:30 will be the board lunch and financial review issues. 1:30 to 2:30 will be the Finance Committee. 3 to 4 PM is the board meeting. 4 PM to 4:30 will be a closed session of the board. And 5:01 PM will be the final budget and millage hearing. Thank you, Thank you, Madam Chair.
Thank you so much, Vic. Does anybody have any questions for him? Okay. Next is our Treasurer's report, Kevin Cooper.
Thank you, Madam Chair. The only thing we have on this item today is approval of bad debts and charity care. And for that, I move approval of the bad debts and charity care for the month ended May 31st, 2025 in the amount of $29,236,000. And for the month ended June 30th, 2025 in the amount of $30,509,000.
Okay, can I get a second? Oh, and all in favor, say aye.
Aye.
Any opposed? Okay, motion passes. Thank you so much, Kevin. Next up is Jen Rosati, our CFO, to go over the financial highlights.
Thank you. This afternoon, I'm going to be presenting the financial results for the month of June 2025, as well as the first 9 months of our fiscal year. All right, our total revenue for month to date, our actual results, $188,553,000 versus a budget of $171,064,000. On a year-to-date basis, $1,625,574,000 versus a budget of $1,582,865,000. Our total operating expenses for the month of June were $164,708,000 versus a budget of $163,104,000. Fiscal year to date, total operating expenses, $1,474,908,000 versus a budget of $1,496,852,000. Our operating income for the month, our actual results, $23,845,000, which resulted in an operating margin of 12.6% and an operating margin excluding EPIC expenses of 13.3% versus a budget of $7,960,000, which resulted in an operating margin of 4.7% with and without EPIC expenses. Fiscal year to date, our operating income is $150,666,000, which resulted in an operating margin of 9.3%, and our operating margin excluding our EPIC expenses of 9.6% versus a budget of $86,013,000, which yielded an operating margin of 5.4% with and without EPIC. For fiscal year to date statistics, our average daily census, our actual results of 943 versus a budget of 950. Our admissions and observation cases are actual results of 65,115 versus a budget of 63,960. Our average acute length of stay results for Sarasota, our actuals are 4.46. The same statistic for Venice of 3.74. Continuing with our fiscal year-to-date statistics, our total surgical cases, our actual numbers, 25,789 versus a budget of 26,226. And our births actual results of 3,502 versus a budget of 3,639. And continuing with our last slide of the fiscal year-to-date 2025 statistics, outpatient registrations, actual 462,073 versus a budget of 463,349. Our emergency care department registrations, actual 136,241 versus a budget of 135,815. And our case mix index for Sarasota CMI all 1.89, Sarasota CMI Medicare 1.99, Venice CMI all 1.48, and Venice CMI Medicare 1.49. And that concludes my report.
Does anybody have any questions for Jen? Okay. Thank you so much. Today, we will have committee reports from the Joint Finance and Audit Committee, as well as the Governance and Effectiveness Committee. Kevin Cooper is up first, and he'll do our Joint Finance and Audit Committee.
Thank you, Madam Chair. We'll run through quite a number of recommendations and motions today covering the Joint Finance and Audit Committee. Pursuant to a presentation of the audit plan for the district's financial statements for the year ending September 30, 2025, we received a presentation regarding a 3-year extension to our partner KPMG's current engagement letter to conduct our external audits for fiscal year 26 through 28. And in recognition of the committee's approval of that, or recommendation of approval, I move that the board approve the 3-year extension to KPMG's current audit letter for 3 years for fiscal year 2026 through fiscal year 2028 as recommended by the committee.
So moved.
Second.
All in favor, say yes, or aye. Sorry, say aye. Any opposed? Motion passes.
Thank you, Madam Chair. Okay, subsequent to that, our Executive Director of Audit Services, Todd Nass, presented an update on the internal audit projects, and then additionally reviewed and proposed audit services audit annual plan for fiscal year 26. And in recognition of that, I move approval for the fiscal year 2026 audit services annual audit plan as recommended by the Audit and Finance Committees.
Can we get a second? All in favor, say aye.
Aye.
Motion passes.
Thank you. And then on top of that, we received a presentation from our Chief Financial Officer, Jen Rosati, which presented the proposed fiscal year 2026 operating and capital budget plan. Also presented the proposed ad valorem millage rate of 1.042 mils, which would stay flat with our prior year. And in recognition of those things, this is kind of a 3-part motion again. Move approval of the recommendation of the Audit and Finance Committee of the fiscal year 2026 budget as presented. Move approval of the proposed fiscal year 26 preliminary millage rate at 1.042. And also move approval to advertise for the first public hearing to adopt the public proposed budget and millage rate for September 9th, 2025 at 5:01 p.m. and the second public hearing for September 25th at 5:01 p.m. in this room.
Okay, can I get a second?
Second.
All in favor, say aye.
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 Thank you. Motion passes.
Okay, and then two budgetary related items followed. Our Chief Legal Officer and General Counsel, David Evans, presented an opportunity for the hospital to, or the healthcare system to purchase some units in the Medical Arts Building. And in recognition of the discussion and recommendation made by the Finance and Audit Committees, I move approval for the purchase of suites 203 through 211 in the Medical Arts Building for an amount not to exceed $3.7 million, and for the fiscal year 25 capital budget to increase in the same amount.
Okay. Can I get a second?
Second.
Any discussion? All in favor, say aye.
Aye.
Any
Aye.
opposed? Motion passes.
Okay, thank you, Madam Chair. Finally, our Chief Operating Officer, Jeff Limbacher, presented update on the Sarasota Memorial Hospital Healthcare System Northport expansion project, which included adding a 3-floor vertical expansion to the approved 100-bed hospital, which can be built out in the future for an additional 108 inpatient bed, as well as a 1 shelled floor on the medical office building for future physician clinic capacity. And in recognition of the Finance and Audit Committee's recommendation, I move approval to add additional funding to the SMH Northport project in an amount not to exceed $57 million, which would bring the total approved budget for the project not to exceed $507 million.
Can I get a second?
Second.
Thank you. Is there any discussion? Okay, all in favor, say aye.
Aye.
Any opposed?
Aye.
Thank you, Brad. Motion passes. Thank you, Kevin.
Thank you, Madam Chair.
Appreciate it. As I'm the chair of the Governance Effective Committee, I will pass the board chair role on to Sharon for the time being. The Governance and Effective Committee met earlier this morning. After approving the agenda and the minutes of our last meeting, we had a presentation from David Evans with respect to revising the boundaries of the 3 hospital board districts within Sarasota County, as required from time to time by our charter. At this time, I move approval of the resolution to revise the boundaries of the 3 hospital board districts within Sarasota County Public Hospital District to ensure the population is nearly equal in the population in each district as practicable as recommended by the Governance and Effectives Committee. David, would you mind reading the resolution?
Thank you, Madam Chair. Permit me just a moment to read the resolution for the record. Whereas the Sarasota County Public Hospital District's an independent special district established by special act of the Florida Legislature and governed by the Sarasota County Public Hospital Board. Whereas the enabling legislation of the Sarasota County Public Hospital District requires that the hospital board create 3 hospital districts within Sarasota County, the borders of which shall be designated as Northern, Central, and Southern. And whereas the enabling legislation further requires that the hospital board, by resolution adopted from time to time in intervals of not more than 10 years, shall fix the boundaries of the hospital board districts along the precincts as they exist at the time the boundaries are fixed. And whereas subsequent to the latest resolution of the hospital board fixing the boundaries dated April 17th, 2017, the supervisor of elections in and for Sarasota County has during various redistricting phases made changes in the boundaries of precincts, the numerical identification of precincts, and created new precincts, each of which presently lies entirely within either the northern, central, or southern districts. Whereas the hospital board desires to revise those boundaries of the northern, central, and southern hospital board districts to specifically identify such new precincts and continue to make such districts as nearly equal in population as practicable. Now therefore be it resolved that the Northern District shall consist of the following precincts as they exist at the time this resolution is passed: 101, 103, 105, 106, 107, 109, 111, 113, 115, 117, 119, 121, 123, 125, 127, 128, 129, 131, 133, 135, 201, 203, 205, 207, 209, 211, 213, 215, 217, 219, 221, 223, 225, and 233. Thank you for your patience. The Central District shall consist of the following precincts as they exist at the time this resolution is passed: 227, 229, 231, 301, 303, 305, 307, 309, 315, 317, 321, 401, 403, 405, 407, 409, 411, 413, 415, 417, 419, 421, 423, 425, 427, 429, 430, 431, 433, 435, 437, 501, 503, 505, and 525. And lastly, the Southern District shall consist of the following precincts as they exist at the time this resolution is passed: 311, 312, 313, 314, 319, 323, 325, 327, 329, 331, 333, 335, 337, 339, 341, 507, 509, 511, 513, 515, 517, 519, 521, 523, 527, 529, 531, 533, 535, 537, 539, 541, 543, and don't forget 545. A certified copy of this resolution shall be furnished by the Secretary of the Hospital Board to the County Supervisor of Elections by the end of the 10th business day following adoption of this resolution.
Thank you, David.
Thank you, David. You can take a breath now. So we have a motion. Can I have a second? Second. We have a motion and a second. All those in favor say A. Aye.
Aye.
Aye. Any opposed?
No.
Hearing none, motion passes.
Thank you.
It was one.
By the way, David, I couldn't. Oh, no, Joe, never mind. I was going to tease David and say I couldn't hear it. Could he repeat it? But I did hear it.
Thanks, Brad.
You cheated.
Next, we were informed that the board will be participating in a board educational workshop on the health system's corporate compliance program in August. And then the last item that was completed discussing regarding our board's philosophy around the CEO's compensation. We heard a presentation and recommendation for from our independent third-party compensation firm, Willis Towers Watson. The philosophy supports the SMH mission, vision, and values and aligns with our goals and strategies. This will help with attracting and retaining quality CEO talent that we require for the continued success. At this time, I move approval of the CEO compensation philosophy as presented by Willis Towers and Watson to the Governance Effective Committee.
Second.
We have a motion. We have a second. All those in favor say aye.
Aye.
Any opposed? Hearing none, motion passes. Thank you.
Thank you. Thank you, Sharon. I will take back that board chair role again. Next up is our president's report by David Verinder.
Thank you, Madam Chair. I am going to look at, like we do every month, I'm going to start with our organizational report card. And we look at the 5 areas of concentration that we look at: service, people, quality, finance, and growth. We do have a goal under each one of those. And then we have ultimately on the right-hand side of the screen what our overall score is. So the first area of concentration is that of service, and our goal in that is likelihood of recommending. The number of service areas that are at or equal to, or greater than or equal to the 75th percentile. We have goal of having 8 out of 10. The areas that we survey meet that or exceed that. I'm happy to report we have 10 out of 10 doing that right now, and I will share the details with that in a minute. The second area of focus is that of people. We have a goal of having our new hire retention, which is our percentage of regular and full-time and part-time employees that have been hired within this fiscal year, still be employed as of the end of the fiscal year, which is, of course, in 3 months, September 30th, 2025. We have a goal of having that be at 83% or higher. I am happy to report we are at 88.97%. In the quality area, our goal is to have our around infection prevention, which is our combined overall standardized infection rate being less than 0.8. Just to remind the board, the national average on that, or expected number, is 1.0, and we are considerably below that at 0.51. The next area of concentration is that of finance, and it's an organizational finance operating margin, which you heard our CFO, Jen Rosati, give her report earlier. We have a goal of having 5% for the year, which is our budget. I'm happy to report we are exceeding that at 7.9%. And then finally, in the area of growth, we have strategic growth, two goals. Our first is our inpatient admissions and outpatient observations. We have a goal of being 82,071 for the year. We are tracking over that at 85,745. And our outpatient registrations at 1.224 million, and we are tracking above that as well at 1.326 million. Next, looking at the detail around the patient experience report card, you see the 10 areas that we survey on the far left. The next column over, or the middle column, is what our score is. The next column to that is the national median, and finally to the far right is the 75th percentile score, which is what we judge ourselves on. Happy to report that we are at or above the 75th in all 10 areas. So congratulations to our staff for taking care of that. Thank you, Sharon. Next up, I wanted to announce some leadership changes in our SMH Northport hospital that is just about to start construction. As we move forward with plans for SMH Northport, we've assembled a team of leaders who will help ensure the new hospital provides SMH's nationally recognized top quality care. I'd like to announce Jeff Wessner, who is currently serving as the Chief Operating Officer of SMH Venice, will be promoted to President, or has been promoted to President of SMH Northport, effective August 4th. I guess it's to be. Over the next 3 years, he will lead the teams of experts who are designing, constructing, and staffing the new full-service hospital and overseeing ongoing operations after the campus is completed in fall 2028. Jeff will report to Sharon Roush, who will assume the new role of Market President in South County and continue her role as President of SMH Venice. In her new position, Sharon will have executive oversight of SMH Northport while maintaining her day-to-day leadership of SMH Venice. And finally, Jeff Mangrum has been named Director of Patient Care Services for SMH Northport, effective July 21, and will serve as an integral member of the planning team for the new hospital. Jeff has previously served as SMH's Director of Public Safety and Emergency Management. He started his career in healthcare as a trauma nurse at Vanderbilt University Medical Center and progressed through a series of clinical and emergency preparedness leadership positions. So congratulations to all three of you. Jeff, you want to wave to everybody so they see you? There you go. I mean, you look so different today than you are usually here. So appreciate all three of you. Next up, SMH ranked one of the best hospitals for specialized care. Sarasota Memorial Hospital has once again been nationally recognized for its excellence in specialty care, earning top honors from Newsweek in its 2025 rankings for America's Best Hospitals for Specialized Care. The Best Hospitals recognition includes the following high-performing specialties: cardiac care, endocrine care, neurological care, orthopedic care, and pulmonary care. The rankings are based on a comprehensive evaluation of hospital performance. SMH is recognized for ongoing excellence in heart valve repair and reconstruction. Sarasota Memorial Hospital has once again received the prestigious 2025 Mitral Valve Repair Reference Center Award for demonstrating sustained superior clinical outcomes in mitral valve reconstruction. Awarded by the Mitral Foundation in June, the designation identifies and recognizes the top medical centers for mitral valve repair surgery. SMH is one of 2 hospitals in Florida and the only one in the Tampa Bay region recognized for this life-enhancing procedure. This is the 5th consecutive year SMH has received this award. SMH's Sarasota and Venice campuses earn Advanced Spine Surgery certification. SMH Sarasota and SMH Venice recently earned Advanced Spine Surgery certification from DNV Healthcare USA, Inc., recognizing their commitment to providing safe, high-quality spine care based on latest clinical standards. The DNV advanced spine surgery certification is based on evidence-based guidelines and standards of practice acknowledged by leading professional organizations. It is awarded to hospitals that demonstrate excellence in spine surgery and ongoing dedication to the best practices in clinical care. Both hospitals underwent a rigorous review process, including an annual survey to evaluate surgical programs, clinical protocols, outcomes, and compliance with the comprehensive certification standards. Congratulations to all your teams. SMH creates pregnancy care team to support prenatal care amid nationwide obese shortage. A shortage of obstetricians has made early prenatal care a challenge for women here and across the nation. To close gaps in care, SMH's newly created pregnancy care team, led by labor and delivery postpartum nurses who serve as OB navigators, helps pregnant women access needed prenatal and maternity care. The team works with the Florida Department of Health, Sarasota County, and other providers to offer free guidance and a broad range of services and support. The program also receives support from the Sarasota Memorial Healthcare Foundation and other organizations working collaboratively to increase access to maternal fetal care in Sarasota, Manatee, and DeSoto counties. Finally, we had our wall signing ceremony, which leaves messages of hope and healing for future patients of SMH's new cancer pavilion. Dozens of donors, SMH leaders and physicians, and staff at Sarasota Memorial's Brian D. Jellison Cancer Institute gathered last month at the construction site at our newest cancer facility, the Millman Cover Cancer Pavilion, to inscribe messages of hope and healing on the interior wall. Susan Millman, who you see her picture there, was recognized for donations that expand and enhance career services at the new pavilion and other initiatives through the years. And Sheila Jellison and her family were recognized for a landmark gift that allowed SMH to establish the Jellison Cancer Institute. The pavilion is set to open in early 2026 and offer a full range of outpatient supportive programs for cancer patients. And Madam Chair, that is my report. I am happy to answer any questions.
Thank you. Does anybody have any questions for David? No? Okay. With that, we will move on to public comments. Because we have two speakers, comments will be limited to 5 minutes. Commenters are reminded of the rules of civility that you have agreed upon to entering the meeting today. I will not interrupt you as you come to the end of your permitted time, but I will let you know when your time is up. You can also look at your allotted time on all of the TVs around the room. With that said, first up will be Lisa Roulette, followed by Ruth Brandywine.
That's all 9. Done?
There's a button. Look up, there's a button on it.
As all 9 of you know, I have been asking for your help to protect patients. Because right now, what's in their best interest sometimes takes a back seat to a corrupt national medical infrastructure that is allowed to negatively impact patient care. Each time our hospital system allows this, you take a step in a direction more in line with a heartless big business and a step away from being a trusted center of healing that always puts patient well-being first. Multiple members of our community have provided authoritative and expert source information to all of you, showing that in a subset of specific situations, it is highly likely that patients are not being protected because doctors and patients don't have the knowledge that you do about the negative impact of the corrupt national medical infrastructure. No one has reached out to me to let me know that the facts I've shared with you are not accurate. You have the duty and the opportunity to learn more about how to address this preventable harm by inviting one of the top world experts on it to share his expertise with you. And in fact, this board met last month away from the public eye in a closed meeting that I tried to attend but was barred from to discuss Vic's motion to invite Dr. Pierre Corey. At that meeting, the majority of hospital board members rejected the opportunity to hear from one of the most qualified experts in the world who has been standing by, ready to help you gain greater insight into policies needed here to reduce preventable harm to patients. Your rejection of this opportunity is stomach turning and appalling, a slap in the face of our community. It is a terrible reflection of the mindset of top policymakers, appearing to reflect a cold indifference that callously disregards the clear need to protect patients from a horribly corrupt national medical infrastructure. Under your watch, our cherished community hospital system is losing its way. Our community deserves to have hospital board members who take officially confirmed, documented patient safety concerns more seriously than most of you are. Our community deserves to have hospital board members decide that patients will not be harmed on your watch when better policy could have prevented that harm. Right now, with very few exceptions, the majority of hospital board members appear to be operating with the mindset of not my problem. I have been witnessing for the past several years a betrayal of our community by the majority of hospital board members. We all deserve better. You owe it to all of us, and you owe it to your own conscience to make it a priority to call for the policy corrections that are desperately and clearly needed to better protect patients here from a horribly corrupt national medical infrastructure. Right now, I'm standing up so we all can have a hospital system that always puts patients first, and where a horribly corrupt national medical infrastructure never negatively impacts patient care. I hope I speak for everyone in our community and everyone here at this hospital when I say we don't want patients to be thrown to the wolves with policy that allows a horribly corrupt national medical infrastructure to negatively impact patient care. We call on all hospital board members to make it a top priority to protect us from external forces that would undermine patient care. We call on all board members to guide Sarasota Memorial back onto the path where exceptional patient care is always the top priority, regardless of corrupt external forces. Thank you.
Thank you. Next up is Ruth Brandwine.
Good afternoon. I will be very brief. I know we all want to get out and spend the rest of the day with some fun. I noticed that you discussed the recommended tax millage rate for the next year, but I'm wondering if you're developing some long-range planning for future millage rates, given the fact of the new national budget that was just passed that will seriously affect people's ability to access Medicaid. If they don't, there will be a huge increase likely in emergency care, and we will end up with a much higher rate of charity care. So I'm just wondering, and I know you can't answer it now, but I would hope that you would take this into consideration if you already have it, and start planning for what might be a serious increase in need for millage rate increase. Thanks.
Thank you, Ruth. Having completed our agenda, I don't believe we have any other legal matters or anything else. Therefore, we stand adjourned. Thank you, everyone.